Our technology employs three different components. One is sudomotor testing. It tests your ability to sweat, which is a nerve function test. There's a second test that looks at the blood pressure in your arms and legs, and that helps us screen you for peripheral vascular disease. And the third part tells us about your nervous system and how well that is functioning. And sudomotor function is simply taking a small electrical impulse, as in a TENS unit. Most patients don't even feel it. And it essentially is taking a small electrical impulse by putting your hands on a glass plate and your feet on a glass plate and sending an electrical impulse to your sweat gland. And it looks at the microcirculation of our feet and our hands. And that will tell us a lot about what's going on at the heart and the bigger organs in our body. So that sudomotor function testing allows us to develop an algorithm to is whether or not someone is going to be at risk for peripheral vascular disease or neuropathy.
The purpose of the testing is to do a complete body assessment on patients, so you can see everything from blood pressures to circulation, maybe to determine why they're having pain when other tests are unsuccessful.
So there are early warning signs that we take into account, and I think that every physician has kind of a gestalt, right, that you develop with a patient, and this can be both a good thing and a bad thing. But previously we have certain tools, and there's labs, there are more functional tests that can help you avoid catastrophe. I think that in the primary care realm, really what you're looking for is how do we avoid a problem? How do we tell who is headed towards a problem? How do we get the people who really need it the care they need?
The most important thing to most physicians is, number one, can I help patients? And you absolutely can. Number two, what's the revenue cycle? Well, what you can realize when you do this ABI test is, on average, our physicians' offices will earn about $150 to $170 per ABI protocol. A physician's office simply needs to dedicate a small space, enough for two people to sit down in a computer code.
Getting beyond, I think, the very basics, right, of diagnosis, when a patient presents with certain risk factors, then you can really tell, is this the sort of thing that we need to look into further? And it's been an excellent initial tool, and then further tool, right? Because evaluation is never monolithic. It always continues. That's where I found that in terms of working this up, helps me separate out what is perhaps transient versus what is due to a more important or serious medical condition.
Let me give you a story about how it identified pain that I had no idea what it was. And I spent 3 years with this young lady who is 41 years old. She has spinal stenosis, and spinal stenosis is just a narrowing in the spinal canal, causes a lot of pain across the back and radiating into the legs. I saw her for 3 years. Spinal stenosis, gabapentin, which is a medication for neuropathy, and we just figured it was neuropathy. Somehow she came in, and every once in a while I like to challenge myself and say, let's just start as if you were seeing the patient for the very first time. She answered the questionnaire. She had leg pain, and I said, you need to have an ABI and sudomotor testing. And she's a nurse. She said, but I have spinal stenosis. We know what my back pain is from, and we know what my leg pain is from, or did we? We sent her for the test. She had peripheral vascular disease. She had a stent placed in her right leg, and her pain in her right leg was gone. Missed it for 3 years. Would never have ever guessed that that was neuropathy associated with ischemia. So doctors that have patients that have chronic pain, it's a great way to really risk stratify your patients, because is it pain or is it not? We don't know. But the sudomotor function part of it and the peripheral vascular disease component part of it, those two parts, they will help us discern whether or not it's true pain or pain that's associated with lack of a blood supply.